This segment is sponsored by Austin Diagnostic Clinic. Did you know January is Cervical Cancer Awareness Month? Dr. Susanne Mathew, an OBGYN with the Austin Diagnostic Clinic, is here to talk to us about the importance of cervical cancer education for women. It's a big, important topic, and I'm glad she's here. Doctor, good morning.
Good morning. Thank you for having me.
Thank you for being here. Let's talk about why Cervical Cancer Awareness Month is so important.
It's really important because it encourages women to make that initial appointment if they haven't already to start cervical cancer screening with pap smears, or to remind people to come back in to continue their screening if it's been a while.
Yeah, absolutely. So many of us, it's that once a year thing, it gets canceled, you forget to put it back on the calendar, but it's so important that people see their doctors, especially on a regular basis. So I have to ask you, why should we get an annual exam with our OBGYN?
So the annual exam allows us to continue with cervical cancer screening, breast cancer screening, keeping us up to date with our vaccinations, including HPV and the flu vaccines. It's especially important because a lot of people, it can be many years before since their last pap smear, so it kind of keeps us on track with that.
And are there benefits to making sure that you're staying up to date with your OBGYN?
Yeah, it does help patients stay established with that provider, build a relationship over many years, and continue to build trust with that provider and keep patients on that schedule.
Absolutely. Okay, let's talk about top risk factors for cervical cancer. It's not, I think, something a lot of people think about until maybe they're having to deal with it.
Cervical cancer is one of the most common cancers in women, and the vast majority of cases are caused by HPV, which is human papillomavirus. A lot of women don't know that they have it, and so the pap smear is one of the ways to try to catch that and to look and see whether there are any abnormalities in the cervix that could lead to either precancerous or cancerous lesions.
I see. And so my guess is that you're going to say that HPV vaccine is one of the top things we can do to lower our risk.
Absolutely. So the HPV vaccine is strongly recommended for girls and young women aged 9 through 26. Our goal is to try to get the vaccine in at that time frame because ideally we want to get immunized against HPV before HPV exposure. So that's a huge thing to help minimize the risk of getting cervical cancer.
Is there anything else we can do to lower our risk?
Staying on top of pap smears is another big one, and the reason for that is we can potentially catch things that are early on before it progresses to cervical cancer, so those can be treated potentially, which will minimize the risk of progression to cancer.
Okay, important information this morning, Doctor. Thank you.
Thank you.
Austin Diagnostic Clinic has 19 locations around the Austin area. To find the one nearest to you, go to adclinic.com. This segment is sponsored by Austin Diagnostic Clinic.